So like Dave. Oh, if I don't answer with my hands. I thought you were saying I could like throw it at Dave. Well, that's I was just thinking hold it. The arms, they're awkward. You can only hold my favorite position. Yeah, right there.
You're the only one that's worried about it.
And now I like called it out.
Yeah.
So
now you're going to be watching.
Sorry. Oh, I don't even hand talk.
Sorry. Yeah, you have one. Hello, hello.
You guys want to grab a box? Sit under.
You can't see it, Todd, but I am smiling. Yeah. Yeah. No, I don't. It only happens once every like 3 months now. Yes, ready for us?
You guys go just get started whenever you want.
Okay. This morning, I was like, out of my ponytail. It's all sweaty and nasty. This is so much fun. This is literally like, this is my ponytail week.
Attaboy, Marcus. Good.
All right. We're ready. I was like, sit down. I know.
All right.
Hey, Courtney, be quiet.
That's more like it. That's one.
I know. Well, hey, thanks for coming. It's our low vaccine workshop. We're excited. If you don't know me, I'm Dr. Julia Carlson. This month is my 8th year being here. Yeah. And I practice over off of Gulf Road at Carlson and Nicole Marquardt. And I'm Nicole, for those of you that don't know me. I've been here 2-ish years now. I've been a PT in the area for the last almost 20 years. I specialize in low back pain. It's primarily what I've been seeing for the last 17 years or so, back and neck, so it's kind of my jam. So thanks for having us. Yeah. So Coach Pat called and asked us if we would come and present. We've seen a large increase in low back injuries, especially post-COVID, and they wanted to help kind of get everybody back on track. So as Julie and I prepared for this presentation, we started thinking about why have we seen such an increase in low back pain in recent months. So it's always a good place to start.
Yes. So, starting ergonomics.
That's our,
Yeah, that one's for you.
so ergonomics. A lot of us have had huge changes with COVID. We've come home to work. We've been working in wonky makeshift desks or at our kitchen tables or recliners, on laptops, all that kind of stuff. So we put our bodies in weird positions 40+ hours a week, and then we come to the gym and we expect ourselves to just perform in the same way that we performed before. And yeah, we haven't set our bodies up for success. So just something to really think about is there anything that's changed in my job or the way that I'm doing things or my commute or just those types of things that could be just putting myself at more risk for injury.
Yeah. Also, home projects. That was a big.
Yes, you're right.
People were hurting themselves all the time with that. So I'm going to talk about emotions because what is the mechanism that makes stress cause pain in your body? I get that question a lot, and I also identify a lot of emotions in patterns so there's tons of anxiety, there's tons of fear. None of us know what's going to happen. So not being able to be social with people too. So low back pain specifically, from what I've gathered in my practice is it's a family issue or a money issue. Those are the two emotions that kind of present as low back pain. And then sciatica, which is pain or numbness all the way down the leg. There's all kinds of variants with that, but mostly I see that right now, and it's very acute and very persistent. So low back pain that hurts really bad and prevents you from doing a lot of your daily activities, and then it's very persistent and doesn't like to go away easily. So those are the two ways I've seen it recently.
Definitely. And you open because there's a lot of anxiety over being laid off, so the financial changes, or I've even seen just tons of people have pay cuts and all the things that go on with that. So really check how you're feeling and check in with your body and how those emotions can be definitely impacting how you're feeling. Activity level changes. This is huge. All of us, when we went home, you guys, the coaches did a great job of giving us a lot of options of things to do at home, but maybe we didn't have the equipment. Maybe we weren't quite as motivated because we didn't have that person next to us pushing us. Maybe we weren't doing the workouts at all because we weren't coming to the gym. What were you doing at that time that you were home and the gym was closed, and then you walked back in here and expected to be in the same place that you were at 2 months prior? And that's just not going to happen. You can't take a couple months off and come back and just keep lifting at the same intensity, the same weight, doing the same things, and not expect your body to not say hello in a way that may not be positive.
And the last portion of the first part here is fight or flight, and I also put adrenal fatigue there because stress induces your body into the stress response. So your body reads your outside environment as possibly predators after you, or thoughts, toxins, and traumas is what I say in my practice. So any of those things can cause a stress response in your body. And when you elicit a stress response, and think of it like when you're speeding and you realize there's a pop and you slam on the brakes and that kind of rush of adrenaline, that's normal. That's what we should be feeling because that shunts blood to our muscles and things like that. But people are on more like a slow IV drip of adrenaline all the time right now because of the stress that's happening. What that does is it takes the energy that should be running your muscles, organs, and glands and pushes it into the nervous system to try to keep you in survival, like you're in survival. So that causes pain, it causes all sorts of other things, but that's why it becomes persistent, is because those adrenal glands, they're firing constantly when they should be just shunting stress hormone when it's appropriate. So that's another reason why people are staying in pain or not recovering as fast, and that degrades muscle tissue, that causes sugar cravings, it causes poor sleep, it causes all kinds of things. So getting out of stress is like super important. So I'm going to go ahead with chiropractic care. In my office, we do a full workup that includes a nervous system scan, and the reason why we do that is because the nervous system has so many components. It is what runs our systems. It is what runs our body. And so if we don't know what's going on with that, we can't appropriately treat you, and that includes pain. So I have a heart rate variability, and that shows us how well the nervous system is functioning in terms of fight or flight. So it literally shows you if you're stuck in fight or flight or adrenal fatigue. The second one is a thermal scan that shows how well the nervous system is communicating information between the brain and body. So we can actually tell where is the nerve problem, like where is the problem that you're not getting the good communication between your brain and your body, especially for low back pain. It's really important. And then the surface EMG shows how your muscles are being utilized and how well your nervous system is utilizing the energy locally to that area. So I use that to determine what it is that you need. And also it's really good for showing like where's the primary problem. Like if your primary problem is that you're stuck in fight or flight, you're Your problem isn't in your low back. So let me circle around here, because it seems like if there's a problem there, that's where, if it hurts there, that's where the problem is. But that is not always the case. Sometimes our bodies keep us in that fight or flight, and then it causes a pain because of the muscle tissue or the physiology around it. So knowing the difference, whether it's mechanical pain, where it's actually stuck on the nerve, like the bone is out of place, pushing on the nerve, that's like 10% of what I see. 90% of what I see is because people are stuck in a stress response. So I also put low vagus nerve tone, which, if you've ever heard of the vagus nerve, it's a cranial nerve, and it is the nerve that causes us to have like our brake pedal response. So fight or flight is the gas pedal, the vagus nerve is your brake pedal. So it slows down those stress responses. Well, right now, none of us are very good at getting out of fight or flight and then kind of swinging that pendulum over to rest and relaxation. If we did that more, we would have less pain. So we have to be really vigilant about like boundaries with not good people, and going to the chiropractor, and just eating healthy food, drinking lots of water, getting enough electrolytes, like those kinds of things are going to help so much in slowing down that nervous system response so that your body actually has a moment to heal. Because that's what it really comes down to. When you're in fight or flight, your body cannot heal itself, no matter what you do. So you have to be out of that stress response in order to get your body to heal itself.
Okay. And for PT, we same tools, different way of looking at things in a way. If you come see us, you'll get a full evaluation. We're going to really break it down, talk to you about what you've been experiencing, do a full evaluation, look at how you move, where you're strong, where you're weak, what's going on with your body, what's that underlying cause. Looking really at the biomechanics. We're going to talk a lot about ergonomics, what you're doing, how you're going to return to activity. We do a lot of things to help decrease that nervous system and help get you feeling better. Lots of different modalities. It depends on who you see. Just like chiropractic, there's a lot of variability, like Julia just described her approach. I'm sure if any of you have seen other chiropractors, there's just tons of different approaches. But some things you might see from a PT would be dry needling, instrument-assisted soft tissue mobilization, taping, joint mobilizations, and then of course therapeutic exercise. So one thing I think that we're really good at is that prescription of exercise. And so what I'm hoping to help you guys with a little bit today is understanding if you're having low back pain, where in the heck do you start looking? Because it's so overwhelming to think of all the things that we need to do to take care of ourselves. And maybe it's not even just your low back that hurts. Maybe your shoulder feels a little bit clunky. Maybe your knee feels a little bit clunky. And we all try to come to the gym, we all try to take care of ourselves, but then I should go home and I should do mobility and I should do strengthening and I should do this and I should do that. And it's, oh my gosh, I can't get all this done. And then your coach looks at you and says, well, if you're doing what you're supposed to do at home, well, I'm sorry, I don't have time to do the 25 things that I need to do at home to take care of myself. And I know Kat just gave me this lecture this week and asked me what I was doing, what I was supposed to be doing at home. But really, when you look at it, if you want to just look at basic range of motion and stretching for the low back, you really need to think about a few key groups that could be causing your problems. Lats are a huge contributor to low back pain. Hip flexors, another big contributor. Hamstrings are another big contributor. Piriformis muscles, which run through the deep buttock, are another big contributor. That's 4 muscles right there if you took time to stretch all of them, which you may not even need to do, you're going to be overwhelmed. Well, then if we talk about, well, some people need core strength. Okay, well, now I need to strengthen my core. Well, gosh, my ankle might be tight. Now I need to stretch my ankle. It's just too much to look at. So I'm going to show you just a little bit of screening that you can do, and also thinking about your body type to say, where do I need to focus? Okay? So general rule of thumb, if you're a woman, you probably need more strength. If you're a man, you probably need more mobility. That is a huge, huge, huge generalization, but it does fall into usually true. Think about your body type. Are you long and leaky? Are you shorter and more compact? Do you usually long and lanky people, because you have a longer lever arms, tend to be more mobile. Like myself, I really need to work on my core all the time because I have a long lever arm, and it takes more core stabilization for me. So when you think about those types of things, or you can look at Coach Faith as a great example. If she had pain, we all can picture how thin Coach Faith is when we watch her stretch and do her splits and do all of her crazy stuff. If she came to me and said, my back hurts, I'm not going to tell her, you need to stretch more, because she has plenty of mobility. She's probably lacking stability. So think, I need to work on my core, I need to work on my glutes, I need to work on my posterior chain to be sure that I'm not getting those areas having too much looseness, to be too sloppy. If your coach tells you a lot, your knees are coming in. That's a sign that you're weak in your posterior chain or the side of your hip. So you need to do a lot of those more side steps and things such as that. In terms of mobility, there's some really easy tests you can do to check yourself and see how you're doing. So, Julia, get out on the table for me.
Do you want me?
On your back. Yep.
I just did what half my patients do. Up there, where am I going?
And so you tell people to lay it on their back, and they always lay on their stomach. Every time. Other back, please. Okay. To check your lats, push your back down into the table, and then just bring your arms straight up and over your head. Julia actually has good lats. What in the heck? Nobody has good lats. Worst patient ever. But it's really key that you contract your abs and come straight up. And if you can't, like I'm tight, I can't even do this thing up. So, but our lats, with all the sitting we do and all that internal rotation, really come to be tight. To check your hip flexors, scoot down to the end of the table. Sorry, all the way.
Oh, I did it different. So,
Well,
this will be interesting for me.
you don't do a Thomas test? And then you just bring
I don't
your,
remember that.
just like your knee bend. You just hug your knee up to your chest. Julia has tight hip flexors. If your knee can't stay on the table, she's tight. Hugely important, compare left to right. She's tighter on her right. Do you guys see that? So when you do this, really check yourself. And the reason that this is important is not only to say, am I tight? Yes, my hip flexors need more love. We all know how to stretch our hip flexors. But Julia is tighter on the right. When we think about the hip flexors, they come up and attach into the front of vertebrae 1 through 5, as well as scooping the front of the pelvis. If we're tighter on one side, it's like a tug of war in our body. So if we're tighter here than we are here, that means that we get to see Julia even more often because we're creating rotations in our spine. Or we have a rotation facilitating our defense activities.
Or facilitating an inverted knee when I'm squatting.
That could be too.
There you go.
Back and belly.
Yes.
Come on back up. And then you check your hamstrings. You can either take your band, or you can just put your hand straight behind your knee. Right here. Get it up to 90 and straighten your leg. Women, you should be able to come straight. Men, it's okay to have about a 10 to 15 degree bend. That's normal. And again, compare left to right. Piriformis. Bring your knee to your opposite shoulder. Take up the slack at your ankle. Again, really compare left to right on that piriformis because it connects into both sides of your sacrum. Same thing on the other side. So that's a quick screen that you can run through to say, if I'm tight and I need to spend some extra time at home, where am I going to spend that time? If you have a 90-degree straight leg raise, Faith, you probably don't need to spend a ton of extra time stretching your hamstrings. Yes, you need to give them love once in a while so they don't tighten up, or after we've done a ton of deadlifts or to get ready for deadlifts, but it's not something that you need to spend time doing to keep your back healthy because you have the mobility that you need. Does that make sense? Okay. So really look for those left to right asymmetries We also provided you guys with a few basic exercises at the end that we both really like. So, there are, besides PT and chiropractic, we didn't want to give you a totally, I mean, we are the best. Obviously. We're going to give you guys a totally skewed view. So you can definitely, consider massage, acupuncture, osteopathic manipulation. Many PTs also do osteopathic manipulation. I do it all day. So, I will put that in too. So, and Julia's going to talk about supplements.
Okay, so I added supplements because I thought that people probably just don't know what they should be taking when it comes to these kind of injuries. So something that I really like is beyond your protein powder is a collagen that contains the 5 types of collagen is really good for rebuilding tissue after an injury. You can also get like a cheaper, that's like a couple of different kinds. And that would be for like everyday use, but I strongly recommend that if you're recovering from even like a car accident or something, it's really good to take the 5 types. And there's lots of different kinds out there. So I also mentioned buffered vitamin C. So if you know that you're too stressed out, that is food for the adrenal glands. So buffered vitamin C contains electrolytes too. Why is it called buffered vitamin C? Because it's very high dose vitamin C. So it's something everyone should be on right now anyway, because it protects against viral load. So
Where do we get buffered vitamin C?
you can possibly, I don't know, I have a dispensary on my website that you can sign up for, or I sell it in my office, or I'm not even sure if there's another place that sells it in Eau Claire.
It's on thing.
Yep. It's 2.5 grams of vitamin C, that's what we need to be taking. That's like a therapeutic dose. And then it also contains magnesium and some other electrolytes to increase absorbability so that you don't get diarrhea. Because the high dose vitamin C will give you diarrhea.
Vitamin C with COVID.
Yeah.
So be careful.
You probably have to take like 6 doses, but I hope not. Vitamin D3 is another vitamin that's really great for building cellular structure. Also really good for COVID. Double whammy. A clean protein supplement. And the reason why I say clean, like in my life, I avoid artificial sweeteners like the plague because I have a issue with them, I guess. But the reason why is because artificial sweeteners are a hormone disruptor, so they can actually play around with the hormone cascade, meaning that if your fight or flight stress hormones are being output on a very, very regular basis, then you don't want to have a hormone disruptor in your diet. And then also electrolytes. Electrolytes are also very good for the adrenals, but for muscle contraction. So if you are low and likely you are either dehydrated or low in electrolytes when you injure your low back, that's pretty common. So here's my little spiel on nutrition, but those are all really good things to be on.
Okay. So return to activity after you've been injured. So like we talked about, many of us have been injured, especially recently. And one, what do you do while you're injured? I guess let me back up the bus a little bit. It's great to still be here. It's great to still be working out. Be sure to be working with your coach and letting them know what you're feeling and what is going on, and modify to keep yourself safe, but keep yourself moving. Motion is lotion to our joints. It keeps our muscles supple and keeps us strong. Cardiovascular work and blood flow helps to heal us faster. So unless it's something like you broke something, you should be able to be here. Even, gosh, I remember people being here in ankle boots, and the coach is doing a great job of modifying their activity. So I can't imagine what they can't work with, but maybe broke a couple things. So, but then say your back's feeling better, you're ready to get back at it. What should you do? One, again, really work with that coach. Hey, coach, last time I did hang power cleans was when I messed up my back. I'm giving these a try again. I need you to really keep an eye on me. So if they know that you are maybe struggling with technique, they know that it's the first time back, that way they can really keep an eye on you. It's super helpful to be sure that you're not breaking that technique. 2, and this is even more important, you can't start where you injured yourself. So if you haven't done exercise X in the last 2 months because you've been avoiding it and you've been modifying because it's bothering your back, you can't start back at the same weight that you finished at. If you do, what's going to happen is you're going to end up in what we call a boom and bust cycle. So my back feels good, I'm back at it, I'm super excited, I'm going to do this exercise, and my activity level is going to be here. Oh shoot, it was too early, I'm in pain, now I can't do activity. Now I'm going to be down here. Okay, oh, now my back feels better, now I'm going to do activity, I'm going to come right back up where I was. Oh shoot, now it hurts again, now I'm going to be back down here. And you're never going to get to where you need to get to. However, if you take a step back, come out of your weight, let your body relearn how to move. Remember, our body has incredible muscle memory. Maybe you were moving wrong. Maybe you've actually gained some mobility that you didn't have before because you've been being treated. You need to learn how to control that mobility. So you need to start lower and you need to work up. Then you need to work up a little bit more and then a little bit more. This feels like a step backwards, but it is forward progress. This is not forward progress. This is ending up at the bottom over and over again and hitting your head against the wall and not moving forward. So as much as it hurts our pride or it hurts our feelings to take a step back, that's what we need to do to get better and to come back out of injury without re-injuring ourselves.
That was beautiful. Bring this out of my myself.
I give that lecture a lot.
Yeah. I also give a lecture of maintaining, which you have.
Yes.
And chiropractic obviously is a really easy way to do that. You show up at my office, I adjust you, and then you leave, and I did it all. I did all the work.
Yeah. My office.
Yeah, you're doing it. But it's all in just maintaining a consistent, whatever you decide to do, it doesn't matter because you are the only person who can decide what's good for you and what's going to work for you. So maintaining it by being consistent always. So if you're doing the stretches that we're going to show you, if you're getting adjusted, if you're making a massage appointment, like whatever it is, just do it with some consistency because that's kind of the issue is that this is because this is how you do things. How you do anything is how you do everything. So, we're faster than I thought we were going to be.
I thought so too. Do you guys have questions? We have time for questions.
Yeah. Does anyone want to get taped or something?
Or needles.
Or needles? Yeah. Ooh, what? That sounds fun. Oh, yes. Todd, yeah.
So, as I was younger, I always felt on my stomach.
Yeah.
As I get older, it seems like that's not the right thing to do because you wake up in your back. What's going on there?
Okay, so the question was, I used to always sleep on my stomach, but as I get older, that doesn't feel like the right thing to do. What's going on there?
Oh. Okay. Well, number one, it is very hard to control how you sleep. So, is there a right position? You know what, honestly, if you move positions all night without waking up, that's the best position. That's what I would say because you're moving.
And I think the tough thing about sleeping on your stomach is that you don't tend to move as much. You're kind of there and it's hard. It's not like being on your back and tossing and turning.
Yeah.
Again, motion is lotion to our joints. And even though we don't move as much at night, the tossing and turning does help. And as we get older, that time that we're not moving and that time that we're stiff in the morning does get worse and worse. And so when we can't move because we sleep on our stomach, we feel it more as we age. That being said, like Julia said, you can bang your head against the wall trying to tell yourself you're not going to sleep on your stomach, and you wake up on your stomach. So there's not a great fix for that. Sleep is the most important thing.
This is the thing I want to say. So this is like a normal spinal curve, right? Well, when you lay on your stomach, your bird kind of goes like this. So it's more accentuated in that lordosis, and you're probably jamming your facets together, which are little joints on the spine. You're cramming that muscle, so the muscle tissue is shortening. So that whole time you're asleep, laying on your stomach, you're shortening that spot. You're shortening the muscle. So you get up, you stretch them all out as you're standing. So that's it. It's very difficult to change sleeping positions, but yes, you're right. It definitely isn't better for us, especially if you suffer from low back pain.
And if you have any sort of facet joint arthritis, which is pretty common, it's a common aging process. Think of it like gray hairs on the inside. We all get it.
You know, we didn't talk about is thoracic mobility for low back pain.
We did not. I had it here. It's right here in my notes.
Yeah, what happened to it? It was awkward.
I
edited it, so it was like.
no, I wrote it in.
Oh, you did?
It's today.
Okay.
So, I mean, yeah, go ahead. Yeah.
About 8 years ago, I heard about that, and they told me that my right little right? 3 weeks ago, we're doing that. And, you know, I always get hurt my right side, and I'm doing that sometimes. But my left side,
So I think if I heard you right, you had back problems for 8 years, always right-sided. About 3 weeks ago, while doing the deadlift, you actually had pain on your left side, which is unusual for you. Why? It's a loaded question without looking at it.
I have so many
And
answers.
I assume the answers for you too. Would you like to? I would use, I mean, there's a point, there's a lot of answers here. I mean, the truth of the matter is that if your right side hurts that bad, there's definitely dysfunction on your left side as well. Compensation. At some point, that left side is going to say, I've had it. I've had enough. I've had enough of taking care of you. It's time for you to help out too. I use the lazy coworker analogy all the time. Our body is so many moving parts. It is a great team. Our bodies are the most amazing compensators. And that's what makes pain tough too, because he will, like Julia said, it's not always where you think it's coming from, and that's why, you know, good movement and thorough exam is very important.
Like, if there's mechanical dysfunction, meaning the joints are misaligned, the bone is pushing the disc out, that's causing pressure on your spinal cord, like, there's a lot of ways that it could be off, right? But this is going to be super woo for some of you, but this is what I talk about in my office. Your left side represents your feminine quality. Right side represents masculine. So masculine dominated. This area, family, money. Okay, family, money. So right side, there's something going on. Either it's a problem or it's something you need to work through. Left, if it switches over, there's definitely a woman involved. But that stress can manifest in your body in ways that you don't think it can. Okay, and that problem is there for you most of the time, it sounds like. So there's probably mechanical dysfunction because of that. Okay, so you can have a nerve problem on the right side and have it be on it shows up on the left side, or vice versa. It just depends on how you're hardwired. It really just depends on how you're hardwired. Yeah. How's that answer?
One thing we forgot to cover is the thoracic spine, thoracic mobility. So thoracic means any part of your spine that your rib cage attaches into. One thing that people are amazed on is you have little ribs all the way to here. One little rib is like this, it's cute. It's my favorite rib, first rib. Little U, little U. You get to, yeah, I'm a total nerd, stop laughing at me. So we're here. Thoracic mobility is huge when we talk about low back pain. Again, there's, you know, the low back has to work more if our thoracic spine doesn't move. There's a ton of innervation into our obliques and our other stabilizing muscles that just don't work well when our thoracic spine isn't moving. There's breathing mechanisms, diaphragm, all that good stuff that just doesn't work like it's supposed to. So that thoracic mobility that we spent tonight working on in class is also very, very important. We put that as one of our favorite exercises. And there's a lot of ways to work on your stress and mobility, but it is very, very key for your spine.
I wasn't going to be dropped. I wasn't going to be dropped. What is happening? What happened there?
You just got to take hold.
I got excited. There's that. Okay. So, you just have
This is how I dress
I
today.
guess my opinion of anyone ever got. So, low back, thoracic spine, shoulder blade, right there, wings, and then your back, okay? So what I find in the thoracic spine is people get what's called fixation, which is when the bone is so stuck that it won't move on its own. You can do whatever, you know what? Y'all remember when you were in school, 5th grade, when you crack your back over the backside of a desk, like, and that was like the best back crack you ever got, right? That's because, well, it's probably because we did that. But that it gets so stuck that it does not move. And so all the physiology locally will impact that. Well, what happens is if there's a fixation where it's very stuck and it doesn't move, it'll flatten out your back. So your thoracic curve actually kind of goes in. So instead of it coming out like this, it kind of pushes in, then your body has to compensate for that. So your low back is you're going to tuck your butt, basically, is usually what happens. And then you end up with no firing. I mean, there's so much that can happen with that. So
It
making
also
sure
causes
that's,
scapular.
yes,
Scapular
yes,
spine. So it's all connected.
yes.
The human body's amazing.
You would never come into my office for a low back problem and not get everything adjusted. Like that'd be like leaving the bolts off the tire and change it. That would just be ridiculous. You're all welcome. Do we have any other questions? Yeah.
So you use the phrase, is it motion is lotion?
Yeah.
So as we age, in between the joints and stuff, you know, they have that lotion that's in there, and as we age, that starts depleting. Do you have are there any supplements, we talked about some before, that anyone should take as they age to help that cause, to make sure that there is still good movement in your joints?
There's also good studies that show the more you do exercise, you can keep many of those osteochondral things in apparatus that will actually help to keep that fluid in your joints. It does help.
Okay.
So we are already doing the right things, but and supplements are truly.
So everything that I listed would help increase elasticity in ligamentous tissue, tendons, build muscle, increase the viability of the attachments to the bone. I mean, it would do all of those things. I mean, and you could definitely do natural anti-inflammatories like turmeric is a good one, or ginger. There's all kinds of them. That you definitely have to like kiss a lot of frogs. Like you gotta find out which one is gonna work for you. But they're definitely out there. So I mean, that's the only other thing I would recommend is taking something, you know, that's anti-inflammatory that isn't, you know, a leaf or ibuprofen and eating your stomach and killing your kidneys.
Right.
Yeah.
So you mentioned lats as one of the common things that needs to be more mobile. Is there a particular stretch or exercise that you give your clientele?
I actually do a lot of the prayer stretch and the prayer stretch with side bends. The other stretch that I used to give was like but it takes a lot of coordination. So I would give it to this group. Many of my patients, I love my patients, they're more morons. So you elbows together, sit back. This should be a little bit taller for me.
Well, it's for me, so.
I know. Then you sag your spine, and then you posteriorly tilt your pelvis. And this is a good thoracic elongation. as well as an amazing pec stretch. But it's really hard for the average person to get because you have to let your thoracic spine extend, and then you have to be able to posteriorly tilt your pelvis. And so for a lot of my patients, it's just a little bit too much coordination. You keep your elbows together. So I've gone more to just the prayer stretch with the side bend because it's such a good lat stretch, but anybody can do it.
I have definitely done taping for that as well, where you just either, it depends, if you're not engaging your lats, then using tape with some stretch on it, but it depends on how neurologically intact you are. So if you're really clear in your nervous system, then your body can handle that. But if not, then you do an inhibitory taping where you would just put no stretch on it and just tape in the direction of the lats. So. Does someone want to tape? Should we do that?
I have another question. Yeah. So now you have, so when it comes down to like weightlifters and runners, and you think of like the pelvis itself, you know, that's where the low back house is. Weightlifters generally have that anterior tilt in that pelvis. Runners have more of that posterior tilt on there. Do you look at that a lot when it comes down to if they have that low back pain happening to them, how they're saying, if they're in that position all the time, that's how they walk, that's how they run, that's how they do all this constantly? Like, is there a lot of movement patterns where they need to try to find a neutral position when they're not doing whatever activity that they're trying to achieve it?
I mean, the first thing that comes to mind is hip flexors right away because everyone works at a desk, so you're shortening them.
If they have an anterior tilt.
If they have
If posterior tilt, then we think hamstrings.
Hamstrings, yeah.
Okay.
And very, very tight, not being able to, touch the ground.
Sure.
In an anterior tilt, when your hip flexors are tight, it's a huge glute inhibitor. Anterior hip capsule and anterior hip tightness turns the glutes right off, along with a lot of other dysfunctions. But it's a big one. So we want to be sure that they aren't tight here, even if that's the position that they're holding, and that they can control that motion and try to get them at least out of it and make sure that the tightness isn't there.
If it were me, I would check how well the sacrum articulates with the pelvic bones, and that generally is going to be subluxated, like that's going to be out. And then also the pubic symphysis is another one that I adjust a lot. So your pelvis is one big bone with a triangle bone in the middle, and so either side could be off or both. It just depends on the person. So whether it's anterior or posterior tilt.
Okay. Okay. Thank you.
It's weird how everybody stared.
No, I take.
You want to tape?
Sure.
All right. Do you want it to tape?
So, mentioning tape, there was gonna be a class.
Yeah,
Or-
yes. Yeah, and then COVID happened.
Correct.
Yeah.
So, is that,
Well, yeah, we can reinstate that. We'll just pick a day and
if we
do it.
could,
Yeah. Yeah.
not really interested in that, because I've never done it, and I've seen people do it.
Yeah.
and
Yes. I would love to teach it because it's so easy to do it on your own or have somebody do it for you. So.
Yeah, and that's what I don't know.
Yeah. Yes.
And you know, I mean, everything I can do. Go. What do you want?
Why don't you just go face down? I just adjusted from yesterday, so I can see that later. It's a little better.
Oh, yeah, that's true.
Okay, so I obviously get it by tape and bulk. The type of tape matters. Rock tape is the best. It is the most cost effective. It's the one that sticks on the best. This is not my favorite. I don't like black. I like black with the logo, so it looks kind of like this, only reverse. The reason why I like it is it's a little thicker, so it stands up to like when you take a shower and stuff. But it sticks the best. It's tried and true. I've been taping for 12 years.
It makes a big difference.
And well, you're getting what the place I ordered it at is really what you're getting. Okay, so I buy it in this bulk because then I can like cut it into strips if I want. So that is more
Charles has to go back in right now. I'm going to do an inhibitory taping with a decompression strip. And this is probably the most simple tape you can do. And I have round the corners because then it doesn't catch on your clothes. It also catches on your clothes, but that's it.
It is past protection.
I'm going to have you put your face down because that will affect the pull on the muscles. So when I apply tape, I peel it off the bottom and I hold it like this and attach it to the skin just like that.
How many of you in the crowd have been taped before?
And I tape just below. I tape just below the SI joint, kind of on top of the boot. And I kind of go up to right where the spine curve changes. Sometimes a little more. It's not an exact science by any means, unless we're talking about stretch. If you're no stretch on this one, this is what I call an inhibitory taping. So we're not putting any stretch on these parts at all because it's got super overactive erectors right now. Erectors meaning the muscles next to the spine. This is just, I know what I mean.
They're also called erector spine.
Oh yeah, okay. Well, the best way that I have found to describe tape is it lifts the skin, fat, and fascia up off of muscle tissue and provides a gradient for blood to flow in, increase the oxygen of the tissue locally, and then bring in some healing. But it can also make your muscles contract because it's got, they didn't really know all it could do until after it was invented is really what it comes down to, because there's some proprioceptive qualities to it. Your body will engage if there's more stretch on it, depending on how much stretch. You can hurt yourself though if you put too much stretch on it.
Can you explain what fascia is?
Fascia is the outer covering of our muscles that separates all of our muscles out from each other. It has lots of nerve input, which is one of the main reasons why we have so much pain in local areas. It can bunch up and cause all kinds of problems. It can get very bristly. You can get scar tissue in it. So if you've ever heard of Graston or guasha, those kinds of things, golfing, like those kinds of things break up the tissue.
There's also just basic hands-on techniques that will help myofascial release where you can break up the fascia.
So no stretch on the outside. And then what I do is I start on one side, I hold it down really tightly and stretch maybe like 50% in the middle, right across the low back. And then no stretch on the sides. If there's stretch on the sides, it'll cause blistering and tear the skin. And that's basically it. It's literally just the distraction between and laying it down on the skin.
Can you show that? What you take? They have Charles stand up and then.
Yeah.
And now Charles can shower with this on. He can get on for usually 3 days.
Pull up your shoulders. So there, it's just an H pattern.
Each pattern.
And you kind of put the tape here where the pain is. So you're distracting over the top of the spine where the pain is.
Thank you.
So is it
It's asking the body to stop it. Like the muscles that are overactive, I ask them to quit, and then I asked the spine to kind of, because of the proprioception, I asked it for more awareness. Be more aware, and then increase blood flow in this area.
So this will stand for.
I mean, I've had people come in and have it on for like 2 weeks. It's disgusting. But I mean, it just depends on like if you don't let it roll and things like that. So 5 days, 4 days. Just it depends on where it is. On your little back, you can keep it on there for quite a while. But if it was like on your foot, 2 days. It's warm because it does bring blood flow in right away.
Yeah, because I feel it.
If you can imagine it just kind of lifting up enough for the layers to pull apart, and then blood just starts flowing in because it's got a place to go. Passing. Any other questions?
No.
Wow, we
That's
covered
it.
everything. We did an amazing job.
You did it. Nailed it. Thank you so much.
Thanks for having me.
Absolutely.
Yeah.